Dealing with depression, particularly in somebody who's high functioning like myself with a job, a career, kids, family, it's sort of like having I've described it as like having a low-grade fever, even on your best days, where you just got to get through the day. You don't really feel that great, but it's every day. And when you have that feeling, it's very tiring. Weeks are exhausting as life goes on, and it's very hard to get through just normal functioning life.
Psychiatry at Yale has been consistently recognized for its expertise in research, education, and clinical care.
Yale New Haven, in its collaboration with Yale University, has really been pushing to lead the field forward. It's really been the center of translational neuroscience and translational clinical research. So not only are we working at the most basic levels trying to understand the molecular aspects of these disorders and the treatments, but actually finding ways to rapidly bring them to clinical care.
I think it's really exciting to be part of this group in this hospital because we are on the cutting edge. We are providing treatments that many other hospital systems, that many other academic organizations are not providing patients. And so rather than a patient being referred to us and saying, well, you need this because that's what we do, we try to work with the patient to figure out what's best for you and what works best with your lifestyle.
I had researched TMS as a potential treatment. I kind of looked it up because I was trying to find something that would help. And when I heard about the Yale New Haven program having it, I sought out Dr. Katz. The difference after having this treatment is, I can really say, is about night and day. I feel better every day rather than just some days.
TMS is one of a number of cutting-edge interventional therapeutic techniques that we have here at Yale New Haven Psychiatric Hospital on the Interventional Psychiatry Service. Along with repetitive transcranial magnetic stimulation, we offer ketamine infusion therapy, intranasal S-ketamine treatment, and electroconvulsive therapy, as well as expert medication and psychiatric evaluation.
I've been undergoing electroconvulsive therapy treatments for about 2 years on a maintenance level, which means once a month, and it has significantly positively impacted my life. Electroconvulsive therapy has been the most effective thing for me and is the least invasive to my life.
I'm receiving intravenous ketamine, and it has been an experience unlike anything else. For the first time ever in my life, I'm incredibly hopeful for my future and also the future of other people who are suffering severely from mental illness.
At Yale New Haven Hospital, we are using measurement-based care to change the way and improve the way we deliver care every single day. Measurement-based care with transitional age youth helps us to determine the appropriate level of autonomy, the appropriate level of self-reliance, and most critically, it helps us with the diagnoses of individuals as they are entering into adulthood.
When I'm sitting across from a patient or a family and I'm showing them and we're looking together at what the tool is describing is happening in their treatment, I can't tell you how many times there's an opportunity for someone to say, wow, I didn't realize how much my depression was changing or how much my anxiety was going down. And sometimes it doesn't feel like things are happening or changing or moving because the work is so hard and it's so intense. But when we take that step back and we're looking at the measurement together, it's this opportunity for us to say, look at what you're doing, look at what we're doing, look at how effective you can be in shaping the course of your treatment and your care.
It's really important that we not just care today, but we look at the bigger picture to help our young people be able to take care of themselves and have the supports around them where they can begin to do that for their future and for tomorrow.
The hospital and the university are very committed to developing the next generation of physician and psychiatric leaders. We have created a physician leadership development program so that we can provide our young physician leaders with the time, resources, and most importantly, the skills to lead large, diverse teams into the next few decades and beyond.
It's an exciting place to work, and I have had the luxury and the honor of being able to train with many of the people who are developing these treatments in the first place.
Nothing makes my career or my job more satisfying than actually seeing work that was originally started at the most basic levels of neuroscience get to the point that you're helping people live lives that are happy and satisfying. Working here at Yale New Haven allows that to happen.